It is now my honor and a privilege to introduce the man with the toughest job in the country, the Secretary of Veterans Affairs, the Honorable Robert A. McDonald. The Secretary hails from Indiana, but grew up in Chicago. He would graduate from West Point in the top 2% of his class in 1975 and served 5 years in uniform, primarily with the 82nd Airborne at Fort Bragg. He would join Procter & Gamble in 1980 and literally work his way up the corporate ladder to become chairman, president, and CEO of the company. A year ago, the president asked him to take control of a VA in crisis, a nationwide crisis to access care that severely damaged the confidence that America's veterans must have in their VA. Proper leadership, management, and accountability are the only requirements the VFW has ever demanded from the VA. And despite a huge plus-up in emergency funding and the passage of the Veterans Choice Program last summer, his department's challenges are still to identify and fix what's broken, to hold employees fully accountable to the maximum extent of the law, and to restore the faith of veterans in their VA. Mr. Secretary, I am impressed with your open door policy, and I promise the VFW will be there to help you fix the VA, just as we will be there to point out necessary courses of corrections through our nationwide surveys and the face-to-face meetings you have with our Washington office staff. Our job as veterans advocates is to ensure the VA succeeds, and I appreciate the fact that the VFW is able to provide a voice you want to hear. Comrades and distinguished guests, please welcome the Secretary of Veterans Affairs, the Honorable Robert McDonald.
Thank you. I want to thank Commander John Stroud for his leadership of the VFW and his partnership with us in transforming the VA. I also want to thank John Bajetsky, your new now Senior Vice Commander-in-Chief and soon-to-be Commander. I look forward to working with you, John, Big John, and learning from you as well as continuing our transformation of the VA. Of course, I want to thank Bob Wallace, who we see quite frequently in Washington, D.C., for his help, his counsel, his leadership. I want to thank Bill Bradshaw, Director, National Veterans Service. Members of the VFW, fellow veterans, ladies and gentlemen, working at the VA is a high calling. It's the highest calling. We have the best, most inspiring mission in government to care for those who have borne the battle and their family and their survivors. And we have the best, most deserving clients in the world. There are over 22 million veterans in this country. About 9.1 million are enrolled for VA health care. Some went ashore at Omaha Beach, and some answered the call after 9/11. Whatever their age, wherever they served, we honor them, we advocate for them, and we care for them when they need us. Recently, some people in Washington have begun to question the need for a VA. One thing I've learned since my confirmation as Secretary is that there is no substitute for VA. Veterans need the VA, American medicine needs the VA, and the American public benefits from the VA. So you may ask, what's so special about VA healthcare? Well, the VA healthcare system is supported by 3 pillars, a unique system that depends on the strength inherent in all 3 of those areas: research, education, and clinical care. VA researchers have made major contributions to medical science, earning 3 Nobel Prizes, 7 Lasker Awards, and many other awards and recognitions. Among those achievements are the first implantable cardiac pacemaker, the first liver transplant. VA invented a nicotine patch to help smokers quit. There have been multiple advances in prosthetics, in identifying generic risks for numerous diseases, and in treating spinal cord injuries in the Bronx VA. Groundbreaking strides in treating the signature wounds of today's conflicts, PTSD and TBI. We were also the first large healthcare system to develop a system-wide electronic health record and the first to begin barcoding medications to connect patients with medical records, with medicine. This year, the VA will invest $1.8 billion in over 2,200 research projects involving nearly 3,400 VA researchers. This is research that will help not just veterans, but countless other Americans for generations to come. We're affiliated with many of the best medical schools and training programs and over 1,800 educational institutions. We train 120,000 healthcare professionals a year, more than any other medical system in our nation. We train 62,000 medical students and residents, 23,000 nursing students, 33,000 students in other health fields. We train an estimated 70+% of all U.S. doctors, and we're the largest employer of nurses in the nation. We have great people at the VA. 1/3 of our employees are veterans. We operate 1,900 points of care, serving 9.1 million enrolled veterans. Last year, we completed over 55 million appointments for 6.6 million unique patients of the 9.1 million veterans enrolled for health care. We're a national leader in telehealth services, caring for 700,000 veterans, over 2 million telehealth visits in fiscal year 2014. We're also a national leader in reducing MRSA infections, those infections that occur in hospitals, down 69% since 2007, compared to 30% down for non-VA hospitals. Since 2004, the American Customer Satisfaction Index has shown that veterans give VA health care higher ratings than patients at most private hospitals. VA researchers continue to receive awards for excellence like the ones you see here. Take a look at the second bullet. 26 years ago, Dr. Bill Bauman was an endocrinologist at the Bronx VA when he hired Ann Spungen, an applied physiologist, to help test the respiratory functions of paralyzed veterans. When Bauman shared his dream of learning how spinal cord injuries have caused many parts of the body to function poorly, Spungen quit her job to join his research. In 2001, they established the National Center of Excellence for the Medical Consequences of Spinal Cord Injuries, where they and others have worked to improve the quality of life for paralyzed veterans. Last year, Drs. Bauman and Spungen were honored with the Samuel J. Hyman Service to America Medal. Now, VA does face some serious challenges. While the total number of veterans is actually declining, the total number of veterans needing VA care is increasing, not because of Afghanistan or Iraq, but because of the aging of the veterans who served during the Vietnam era. This chart reveals an astounding shift. In 1975, the year I graduated from West Point, there were about 2 million veterans over the age of 65. In 2017, there will be almost 10 million veterans over the age of 65. 46% of veterans will be 65 or older in 2017. If we don't build the capacity today to care for them, we could be facing another access crisis 20 to 30 years from now. We have to build that capacity today. Simultaneously, the number of claims and medical issues and claims have soared. As this chart shows, in 2009, the Veterans Benefits Administration completed almost 980,000 claims. In 2017, we project we'll complete over 1.4 million claims, a 47% increase. But there's more dramatic growth in the number of medical issues per claim, 2.7 million in 2009 and a projected 5.9 million in 2017. That's a 115% increase over just 8 years. As one ages, more issues become more chronic and more problematic. Now, these increases were accompanied by a dramatic rise in the average degree of veterans' disability compensation. For 45 years, from 1950 to 1995, the average degree of disability was about 30%. Since 2000, the average degree of disability has risen to 47.7%, as this chart shows. The percentage of veterans receiving VA compensation follows the same pattern. From 1960 to 2000, it was stable at about 8.5%. But in just 14 years, since the year 2001, it has more than doubled to 19%. So while it's true that the number of veterans is declining and the number of those seeking care and benefits is increasing, and it's increasing for these reasons. As I said, the aging of the veteran population, more than a decade of war, Agent Orange-related claims, an unlimited claims appeal process, increased medical claims issues, far higher survival rates of the wounded on the battlefield, and more sophisticated methods for identifying and treating veterans' medical issues. Veterans' demands for services and benefits has in the past exceeded VA's capacity to meet it. It's important that Congress and the American people understand why that is happening. Compounding the problem, VA is saddled with some serious aging infrastructure. 900 VA facilities are over 90 years old. More than 1,300 are over 70 years old. 60% are over 50 years old. These older facilities don't meet today's standards for hospital construction. They were designed to produce and provide health care in the 1930s, not in the 2020s. The rooms are too small to accommodate state-of-the-art medical equipment and procedures. They lack the privacy, convenience, and comfort veterans, especially female veterans, deserve. They need to be replaced with new facilities, but for what that we need funding and we need authorization from Congress. The independent budget produced by VFW and our other VSOs estimated that closing the major construction gap will take $19 billion to $23 billion over the next 10 years. And it's costing us money to just keep old buildings on our books. Here's an example. This is an actual building owned by the VA. It's owned and it's in Minneapolis. It was built as a gas station in 1932. We wanted to tear it down and build a homeless shelter on the site, but the building's supposed historic value has made that virtually impossible to do, so it's still standing. VA currently has 336 buildings vacant or less than 50% occupied. That's 10.5 million square feet of space, costing the American public about $24 million a year. Here's what we could do with that money if we had it. We could hire roughly 200 registered nurses for a year. We could pay for 144,000 primary care visits, or we could support 41,900 days of nursing home care. VA is committed to delivering timely, high-quality health care to our nation's veterans. We know we still have too many veterans waiting for care, but we're now providing more care for veterans than ever before in our history, both inside the VA and outside the VA in the community. To meet the immediate demand for access, we've extended hours. We've had 880,000 appointments completed during extended hours. That's on the evening and on the weekends. We've activated 18 buildings to add 1.3 million square feet of space to our healthcare footprint, plus another 420,000 square feet in VA-owned properties. We stepped up recruiting of new personnel. 38,000 we've hired in the past 10 months for a net increase of 12,000 hospital employees, including 1,000 more physicians and 2,700 more nurses. We've had a 45% increase in authorizations for care in the community. Now, speaking of care in the community, VA has been referring veterans to care in the community for decades, whenever it's made sense for veterans, and we're very much in favor of making greater use of the Care in the Community program to meet the access challenge. But we know that many veterans prefer VA health care. In fact, in VFW's own study, veterans showed that 47% offered choice elected to wait for their care inside the VA. 78% were satisfied with their VA care experience, and 82% would recommend VA care to fellow veterans. But one thing to keep in mind, most veterans already have a choice. 81% of veterans have either Medicare, Medicaid, TRICARE, or some private insurance. Many come to VA because of the disparity in out-of-pocket costs between their insurance and VA care. Let me give you an example. The average Medicare reimbursement for a knee replacement is $25,000 with a copay of 20%. Choosing VA for your knee replacement saves the veteran $5,000. We're providing regular updates of patient access data so that you can see how well we're doing. Now, no private healthcare system I know of is doing this. No private healthcare system wants to be measured by appointment wait times. This is not an accepted industry practice, but we're doing it. And here are the results. We've had 7 million more appointments completed by VA or through VA in the community in the past 12 months. 7 million more completed appointments. 97% of appointments are now completed within 30 days of the veteran's desired date. 88% are within 7 days. 20% are same-day walk-in appointments. The average wait time for completed appointments is currently 4 days in primary care, 5 days for specialty care, and 3 days for mental health care. There's been a 12% increase in after-hours and weekend appointments. We've expanded virtual care, 36% increase in secure messaging, 19% increase in telehealth, 36% increase in e-consults, a 93% reduction in the new enrollee appointment request list, a 47% reduction in the electronic wait list. Of course, healthcare is just one of 9 VA lines of business. Other lines include life insurance, mortgage insurance, pensions, disability compensation, memorial affairs, and education. We've got reason to be proud in those areas as well. We guarantee 2 million home loans with the lowest foreclosure rate and the highest consumer satisfaction rate in mortgage lending. For the past decade, the American Customer Satisfaction Index has ranked our cemetery system the top customer service organization in the nation, public or private. In the past 2 years, we've cut disability claims backlog by about 80%. It peaked at 611,000 claims over 125 days in March of 2013. It's now down around 125,000 claims over 125 days. That's the lowest it's been in 6 years. On the average of claims already underway, we're at about our 125-day standard. Now, how did we get there? Well, we got there by fielding a new electronic system for handling claims. We hired more claims staff, but we need even more. We had them working mandatory overtime for much of the past 4 years. The mandatory overtime can't go on forever. To keep the backlog down, we need to right-size our claims staff. We need the help of Congress. We need to hire more people, and we need the money to fund them. If we don't fund this requirement, we can't be expected to meet our requirement, and that's what I keep telling members of Congress. As you see here, we've also made substantial dent in veterans' homelessness, which has declined about 33% from 2010 to 2014. But any veteran being homeless is one veteran too many. Ending homelessness is an effort between the federal government and the local government, so we're working with over 2,000 partners all over the country. Over 700 civic leaders have accepted the First Lady's Mayor's Challenge to end veterans' homelessness by the end of the year, including 550 mayors, 8 governors, 151 county and city officials. Last December, New Orleans became the first major city to meet the challenge. Phoenix, Salt Lake City have made major milestones in 2015. Of course, to meet the challenges of the 21st century, VA will need adequate funding. The President's 2016 budget request will provide the funding we need: $168 billion, $73.5 billion in discretionary funds, and $95.3 billion in mandatory funds for benefits programs. The discretionary request is an increase of $5.2 billion, or 7.5% above the 2015 enacted level. This will provide resources to continue serving the growing number of veterans seeking care and benefits, and it will help us get ready for the aging of the Afghanistan and Iraq veterans. The budget will increase access to medical care and benefits for veterans. It will address infrastructure challenges, including major and minor construction, modernization, and renovation. It ends the claims backlog and veterans' homelessness in calendar year 2015. It funds medical and prosthetics research, and it addresses our aging IT infrastructure and modernization. However, in the House of Representatives, the budget was cut by $1.4 billion, and that's what the House voted to do. If we applied that House budget, here's what it would cost veterans. There'd be $688 million less in veterans' medical care, the equivalent of over 70,000 veterans receiving VA medical care. There'd be no funding for 4 major construction projects or 6 cemetery inspections. In fact, the House budget cuts VA construction by 50%. It would inhibit hiring and retention of the best people by prohibiting performance awards or bonuses for Title V, SES, and other employees. And it denies VA the budgetary flexibility needed to serve veterans the way they want to be served. I mentioned earlier that some people in Washington are questioning the need for VA. Others are attempting to squeeze the needs of veterans within a sequester budget that artificially constrains the budget regardless of what it means to the programs we're trying to operate with in the VA and across the government. All of this, the lack of flexibility to give veterans real choice, the cuts, the discussions about whether veterans actually deserve a medical system to call their own, leads to the same place, a place where the needs of veterans are secondary to ideology, scoring political points, and short-sighted budget policies, a place where VA is set up to fail, a place where there are no winners, and veterans who have sacrificed so much for much nobler purposes are the ones left suffering. That's unacceptable to me. It's unacceptable to the President, and it should be unacceptable to anyone who claims to actually care about the sacred responsibility that we as a nation have to care for those who have borne the battle. That's why I'm here. That's why you're here. And that's why we need to press forward in putting veterans first. We're listening hard to what veterans, Congress, employees, and VSOs are telling us. What we hear drives us to a historic, department-wide transformation, changing VA's culture and making veterans the center of everything we do. We call it My VA because it's what we want you to think about when you think about the VA. We want you to think about it as your own, customized for you. There are 5 strategies We want to improve the veteran experience to be seamless, integrated, and responsive. We're working with the best private sector customer service companies like Disney, like Starbucks, like Ritz-Carlton to learn how to do that. We want every veteran to be warmly embraced when they walk in the door. Number two, we have to improve the employee experience. We have to focus on people and culture to give the veterans the best service they deserve. We have no hope of caring for veterans if we don't care for employees who provide that care for veterans. Number three, we have to improve our internal support services. For example, our computer systems are just too old. The scheduling system that was a problem in Phoenix dates to 1985. Number four, we have to establish a culture of continuous improvement, and we're teaching every employee Lean Six Sigma to help us do that. Number five, enhance strategic partnerships. We know we can't do this job by ourselves, and we have to partner with people who can help us. The key to improving the veterans' experience of VA is a customer service approach. I call it the Platinum Rule. You've all heard of the Golden Rule, treat other people the way you want to be treated. The Platinum Rule is treat other people the way they want to be treated. That's the rule we're embracing at the VA. We've changed our policy to allow veterans to stop and start benefits and add or drop dependents with just a phone call to a VBA call center. That's good customer service. We've also designed a pilot program to allow veterans to see audiologists and optometrists without first seeing a primary care physician. Right now, if you were to change your address in the VA, you'd have to do it in 9 separate places. We're moving to one database, so you can only change it once, and we'll take care of the rest. We're working on expanding Wi-Fi service at VA facilities so veterans and their families can stay connected during visits. We're launching a major effort to better integrate our different contact centers across the VA. Soon, veterans will be able to go to one website rather than the myriad of websites we have today, and we'll have one single 1-800 number that will have a human being answering the phone. Our new Undersecretary for Health, Dr. David Shulkin, has broad experience in both business and healthcare. He's run healthcare systems before, and we were delighted to get him confirmed by the Senate a couple of weeks ago and on board last week. No organization can satisfy its customers if it can't satisfy its employees. So after improving the veteran experience comes improving the employee experience. To do that, we're rolling out a new training course called VA 101. So every employee will understand all of the benefits available at the VA, not only where they work. We're also in the process of expanding city liaison officers around the country so that there'll be more people on the ground. And we're in the process of putting in place community veteran experience boards so that all areas of the VA will come together in the community at a much lower level. Our My VA support services team has made progress toward improving internal systems in support of VA operations. They've completed a 3-month assessment of IT, HR, acquisition, and finance operations. They surveyed veterans and VA employees to find out how we can improve. And we've consulted with national customer service organizations like USAA on best practices in support of services. We're already standardizing policies for VA police at all VA facilities, and we'll be sending our training teams to teach employees how to de-escalate encounters that could pose a threat to employees or to veterans. To build continuous improvement in the VA, we've chosen the team-based performance improvement methodology described as Lean, which many companies have been using all over the world for more than 20 years. We'll be teaching Lean and Lean Six Sigma to employees to empower and enable them to change the processes to improve the VA experience for both veterans and employees. We want every VA employee working to improve the system that they work on, to focus on how we can better care for veterans. Last November, we fielded a new MyVA web tool called the Idea House, essentially an online suggestion box for VA employees. Through the Idea House, we had one HR specialist in Tennessee suggest that we stop automatically mailing out paper copies of reports available electronically. We took her suggestion. We stopped printing 20 reports for a savings of $300,000 a year. That's the kind of improvement we want from VA employees. We're making it easier for other organizations to partner with VA by standardizing our partnership process and making it more partner-friendly. We're also working with communications in communities around the country to establish community veterans engagement boards. The first of these, My VA Connecticut, held its first meeting in May, and we hope to have at least have a dozen in operation by the end of the summer. Finally, this summer, we at VA are renewing our commitment to America's veterans, and we're asking others to join us in that commitment. We're calling it the Summer of Service. In the next 3 months, we'll be turning the spotlight on VA volunteers to thank them for their work that they do and to show others how they can help. We're starting this summer with about 75,000 volunteers, and by the end of the summer, we want to have nearly 100,000, if not more, volunteers helping VA. We're also reorganizing the department geographically. In the past, we had 9 disjointed geographic organization structures, 1 for each line of business, and 1 with its own middle management. We've now moved to a unified structure that has 1 national structure as shown in this chart with just 5 districts, and we're in the process of aligning the administrations to these districts. There's so much more I could tell you about if we had time. More that we've accomplished, but importantly, more that we will accomplish in the coming months. We're listening to veterans more. We're listening to employees more. We're having town hall meetings. We're having open houses. And together we're making lasting improvements at VA so that in the future, both veterans will say with pride, "That's my VA." In closing, VA has the greatest opportunity to enhance care for veterans in its history. We have an opportunity not only to right the wrongs, but to lengthen our lead in areas where we've always excelled, and to take the lead in service delivery areas that are lagging, and to chart new ground in emerging and evolving areas of healthcare. But to do this, we need the continued support of Congress, veterans, veteran service organizations, and the American people to make the necessary changes to keep moving forward. God bless our veterans, God bless the VFW, and may God bless you all. Thank you very much.
He's one of us, Bob McDonald. He cares. He cares. I told him when he first came into office that the VFW has his back and that I wished him every success because his success means good things are happening for our veterans.